Welcome back to Dental Vibes. I'm Carla.
And I'm Gabby. And today we're going to talk about how to ask for a raise.
Yeah.
This is something that it could be a little bit awkward. It's an awkward conversation to have, but sometimes it just has to be done.
Yeah, I mean, it kind of sucks sometimes because we work so closely with the dentist. Like, they should know. I mean, we're working this hard. We've improved this much. Like, we're due for a raise. But, you know, if it hasn't happened, it needs to happen.
Exactly. So we think that first thing you need to do is do a self-evaluation and put some things down on a list. So you're prepared to go into that conversation and anything they throw at you, you're ready to answer. Number one, when was the last time you had a raise? Was it 6 months ago? Was it 5 years ago?
Oh my gosh.
You want to know when was the last time you had a raise so you can argue that.
Or if you recently got a very big raise, then you probably have to wait too.
Yeah, or maybe ask just for a small one. So it depends, but you want to know the date because you can argue that. Say, hey, I got a raise 5 years ago, so I am super due.
Yeah. Now, the second thing that you must consider is have your duties increased. So maybe when you started, you were, fresh out of school, you didn't have much experience. But now you've learned so much in their technology, you have improved in your expanded functions, and you're like, hey, I used to do 5 things and now I do 1 million things. Well, you can't do 1 million things for the price of what you started with. So consider those things.
Number 3 is your office hitting their goal or even going over their goal.
Oh.
Right?
Yeah.
So if your office is hitting their goal or going over their goals, then you know that they're booming.
Yeah.
There's no reason why they should tell you, oh, we can afford to give you a raise.
Yeah, no reason at all, Now, our fourth thing to consider is, are you part of the reason why the office is booming? For example, did you turn around 4 limited exams into 4 preps, and so you sacrifice 15 minutes of your lunch to do that? Like, hey, that's your contribution towards making that monthly goal.
Yeah, I mean, I'm working my butt off, working through my lunches, staying late so we can get this production.
Exactly.
I need to be compensated for it.
Yeah, absolutely. Now you may ask us, hey, Gabby, Carla, when is the best time to talk about this? Ask for a raise. Well, ideally, you have a review coming up because that is the best time. But if you haven't had in a while and there isn't one scheduled, you're going to start setting up that new tradition.
You're the one who's going to start this new tradition. Review every year.
Exactly.
Yeah. We believe when you're having this conversation, there is 4 scenarios that could go down. First scenario, they hear you out and they say, we totally agree with you. You've been great.
Yeah.
How much do you want?
Ooh.
So you want to make sure that you do your math before this meeting.
Exactly.
So you can say right there and then, this is how much I need.
Yeah. And don't stutter.
This is how much I need, and that's that.
Now, the other thing that could happen is that, again, they say, yeah, you're great, you're right, you deserve a raise. We're going to give you 5 cents. You may ask, do I take that?
Hell no.
Yeah, actually, you will take it. You'll be like, thank you. But
thank you for my 5 cents.
Yeah. But this is where you're gonna, negotiate. This is what I was expecting. And then again, you pull up your list that we talked about, and you say, because X, Y, and Z.
That is actually a good idea because when I started, they gave me a raise, and it was not the raise that I was expecting.
Yeah.
So I said, absolutely not. I was a newbie, and I was there for a year, but my duties have increased. I was the lead assistant within 6 months. I was the right hand, for everything. So I deserve to get a good raise.
Yeah.
So I said, no, I need this much.
Now, since you say you were a newbie, how did you know how much you were gonna ask? Like, when you were like negotiating.
I talked to some of the assistants that worked for the company As a newbie, you don't really know what to expect.
Yeah.
When I first got hired, I was like, oh, this is a good salary.
Yeah.
And then I started talking to other assistants and I'm like, what's going on here?
Yeah.
They're taking advantage of me.
Yeah.
So I was like,
happens.
no, this is how much I need to make. I need to make around what everybody else is making because I'm putting in the work.
Yeah.
And they're like, okay, well, since we're corporate, we're gonna have to give you a diary, pretty much a diary, and said you're gonna write down all your duties that you you have and everything that you're giving into the office for the office to be successful.
Yeah.
And then we have to write a letter, get it approved, blah blah blah. Which it happened, and I did get the raise that I wanted.
Okay.
It did take a little bit, maybe a few months, but I did get it.
Yeah. And sometimes even if you're in private practice, they may be like, well, you know, let's just see in 6 months or whatever. But there is a time limit, so don't forget about that.
The other scenario you could encounter, they can say, you are amazing.
Yeah.
We love you. There's no improvement.
Yeah.
You do it all. But we just can't give you a raise right now. We can't afford it right now.
That's the worst, I think for me, the worst scenarios that you can encounter, especially if you like the office. Because you're like, what do? You know?
Yeah. You don't want to leave, but then you want your raise. I think that is an opportunity for you to come with your list again and say, listen, I've been improving in all these things, but how about this? What else can I improve on?
Yeah, exactly. That's a
and
good
if
one.
And they say, no, nothing. And then you said, well, okay, I'm gonna take what you're giving me or nothing.
Yeah.
And I'm going to set some goals for myself.
I like that.
And hey, maybe, I mean, let's say the office does serrate crowns. Maybe if I learn how to skin and design the crowns, that's gonna give the doctor more time to maybe see an extra patient. That's more production, that's more money, and maybe they can afford to give me a raise. So little things like that you can think outside the box.
And even if nothing comes out of it, you're building your own resume. You know, you're getting more experience in something else that maybe, you know, if you decide to find a new office, you can apply that, you know, and probably get a better pay, a better job. Now, what happens when you get to our fourth scenario and it's like you still waited, you negotiated, and it's still a hard no? Well, we keep talking about you need to just put all your cards on the table and evaluate your options. I mean, come on, let's face it, rent goes up every year, right? So we have to pay our bills and we can't have all of our expenses go up every year and we're still paying from like 5 years ago. That just can't happen. And believe me, there's other offices, there are plenty of opportunities. I think the worst part is, like, again, if you love the office, but hey, if you're willing to work with them, they should be willing to work with you.
You have to think about yourself first because clearly they're thinking about themselves.
Exactly. Yeah, good point.
Yeah. This is it for this video. I hope that our tips were helpful. Hopefully, you got the raise that you deserved.
It wasn't 5 cents. Hopefully.
Make sure you leave us a comment. Let us know how that conversation went.
Yeah.
If you have any questions, make sure you like this video. Of course, subscribe to our channel. Make sure to check us out on Instagram if you like dental memes.
And we'll see you next time.
Keep smiling.